Hello, thank you for making the time to hear our presentation. My name is Vanessa Luis and I'll be doing our introduction. Our team seeks to work towards the UN Sustainable Development Goal of promoting good health and well-being. Adahai's mobile clinic's main goal is to combat maternal mortality in rural areas of India, specifically northeastern states, by reframing family planning education and increasing accessibility to reproductive health services regardless of sex, age, and marital status. There are 30,000 maternal deaths a year in India, and two-thirds of those deaths are preventable and treatable. The cost of inaction of not addressing maternal mortality is 20,100 maternal deaths due to inadequate reproductive care services. The unmet need for adequate maternal health care is urgent, especially when the number one cause of death among teenage and young adult girls is pregnancy complications. The map you see on your screen highlights in blue a low maternal mortality and in pink and yellow a high maternal mortality in India. India has been making progress. However, maternal mortality has become concentrated in the northern areas of India. This contributes to low life expectancy and a higher youth dependency ratio. And not to mention the economic benefits of decreasing maternal mortality, India will be able to reap the economic benefits of achieving a demographic dividend. These life-saving policies are for both women and India.
Hi, my name is Carla, and I'm going to be talking about our program, which consists of multiple components. The following slides will be pictures of example pamphlets and infographics that we will be distributing to our community to inform them about these activities. Having a mobile clinic makes our goal of reaching as many individuals in northern eastern states of India feasible. Our mobile clinic will have an assigned team of health workers and medical practitioners to ensure the best quality care for each individual. The team will be divided, assigning each member with a specific task to ensure this fast and high quality care. Our goal is to make our mobile clinic accessible to as many individuals as possible, which is why we will operate for 12 hours, Monday through Sunday, and from 8 a.m. to 8 p.m. Our clinic will visit each area for at least a week, and we will cycle back to the same areas every couple of weeks. So the reason for a mobile clinic is to try to address the geographic barriers associated with health services and help the underserved populations find good, free, quality sexual and reproductive health information and care. Although we are a clinic, our goal is to provide as much knowledge possible to this community, which is why we are offering this educational classes. Our mobile clinic will provide free and low cost classes ranging from sex education to reproductive health and more for any individual in our community. This slide shows an example of an infographic that we would be posting around our community, and our classes will be led by our well-versed volunteers focusing on specific topics, creating a safe space for these communities.
My name is Amrita, and I'll be talking a little bit more about the medical services and supplies offered through the Adya Mobile Clinic. So we will be distributing menstrual hygiene products and low-cost contraceptives. And the menstrual products we will be distributing include reusable and disposable pads, and the contraceptives include male and female condoms and birth control pills. All of these supplies and services will be provided free of cost for the patients. And in order to distribute these supplies, we plan to have trained community health workers to lead the distribution, just in case any of the patients have questions about which options would be the best for them, and the workers would be able to guide them through that process. So we also do plan on providing some medical services such as prenatal checkups and also referrals to more full-scale health facilities for more complicated cases. And to make this possible and a part of our organization, we plan to form partnerships with local organizations and local hospitals just so we have access to the medical personnel necessary in order to provide these services. And in order to keep in contact with the patient and form a better sense of trust with the community, we plan on conducting follow-up surveys after every visit to gather feedback about the clinic services. And we also do, as Carla said, plan to return back to the village at a set time interval to ensure that patients are getting follow-up care and that we establish a strong relationship with communities.
Hi everyone, my name is Sophia and I will be talking about the impact that our mobile clinic will have on the communities. So how does this benefit the individual? We want our clinic to become a place where the patients feel secure enough to be vulnerable and feel free to ask questions and learn about stigmatized topics. We provide these services for free because poverty is one of the most significant barriers that prevents women and other individuals from being able to access essential health supplies and services. Rural women are the focus of our intervention. It is necessary to provide open education classes to families about family affordability, birth spacing, and access to free care for single mothers, women, families, men, and teens. Knowing their options may alleviate the birth risks and maternal health complications will promote access to opportunities that may not have been possible when in the rural states in India. In addition, this will help decrease risk, create better living conditions, and overall improve lifestyle for those in rural northeastern India. Maternal mortality is the main issue we are trying to address, but it can be taken upon many perspectives. Although some family planning has been implemented in India, we have found that there is an unmet need for quality and versatile family planning services in rural communities, specifically in northeastern India. The factors of the large population and unmet need for quality and versatile family planning services have motivated us to address our intervention from a rights-based approach. By providing free access to health services such as prenatal and gynecological checkups, we are eliminating financial concerns as a barrier and working towards making sexual and reproductive health services more accessible to women, regardless of location and socioeconomic status.
Hi, I'm Manisha, and I'm going to be talking about possible risks. So our intervention is not perfect, and we do predict some issues and risk arising during the implementation process. Most of the risks that we foresee are related to social stigma around sexual and reproductive health within the country. One risk we anticipate is the lack of participation from community members, since reproductive health education and service is a taboo subject in India. We plan to mitigate the risk by focusing on addressing the family unit as a whole instead of just women, so we can promote the conversation holistically. We also plan to open our services up to all members of the community, getting rid of any requirements so everyone is part of the discussion. Moreover, many may feel uncomfortable having outsiders come and speak to them about these topics, so we plan to address this issue by using community health workers. We also plan to promote follow-ups with familiar providers and volunteers in order to build trust between us and the community.
Hi, my name is Hang, and I'll be talking about why is our mobile clinic different. One of the most important aspects of our program is its inclusivity of all people. In rural India, the social norm is to only receive reproductive health services if you are a married woman and are accompanied by a husband. However, these services are not only reserved for married women. There is an increased need for young single women to learn about their sexual health and needs, what to expect of pregnancy and prenatal care. In addition, our program seeks to also educate men about this topic as well, as we cannot just put the burden of practicing safe sex, abortion, and pregnancy on women alone. Men have a crucial role in supporting women as well. Although our world has improved so much when it comes to healthcare, maternal mortality is one of the challenges many women face in India, especially in rural areas. Our mobile clinic is designed to solve this problem. We believe that anyone and everyone should have accessible and affordable reproductive and sexual healthcare. Through our services, we hope to inform the communities around rural India to spread awareness, to fight stigma around sex, and as a result, lowering the maternal mortality rate. We hope to empower all men and women to take their sexual health in their hands, to make informed decisions on their own without societal pressure. This is the end of our presentation. Thank you. And this is our works cited page. Next.